The Northern Territory, 1.35 million square kilometres of Australian landscape, stretching from the sands of the Red Centre to the tropics of the top end. This is equivalent to France, Italy and Spain combined. This land is unique and presents unique health needs.
I'm Sara Chalmers. I'm the Associate Professor and Director of the Northern Territory Rural Clinical School. The Northern Territory Rural Clinical School is funded by the Commonwealth Government and administered by Flinders University up here in the Northern Territory. We're one of many rural clinical schools. Initially we were set up to address the rural doctor workforce shortage. However, what we've found is that we are actually centres of academic excellence in our own right. And here in the Northern Territory, many of our students have won prizes and awards, and we're very proud of them. The Northern Territory provides a unique combination of settings for the students to learn. We cover remote medicine, procedural medicine, Aboriginal health and tropical, and for some also central desert medicine. For many of our students, they find that living and working here in the Northern Territory is one of the most exciting things they've ever done in their lives. We certainly try and support them and encourage them to come back.
With 4 territory locations, Alice Springs, Katherine, Nhulunbuy and rural Darwin, Northern Territory Rural Clinical School Training provides students with hands-on clinical training in rural and remote community-based GP clinics and rural regional hospitals.
Alice Springs is a magic place to live and learn. Our weeks are full of variety. We get a huge amount of diversity in presentations and a lot of independence as students, particularly in the GP setting. And as for Alice Springs itself, it's a wonderful place. The surrounding landscape is just stunning and offers so many opportunities to explore. Our weekends could be filled up for years with adventuring into the Macdonnell Ranges. And the town itself is vibrant, it's got a young health community, we feel a part of it, and Alice has everything really that you need.
The Central Australian campus of the Northern Territory Clinical School is located here at the Alice Springs Hospital in the heart of Australia. The hospital services an enormous area ranging from eastern West Australia to New South Wales in the east and from Elliot in the north to the northern part of South Australia. Students are exposed to a fascinating medical and cross-cultural environment. 80% of our patients are Indigenous Australians who come from a cultural background that is absolutely unique. For many, English is a second, third or fourth language. Providing culturally appropriate but state-of-the-art medical care is therefore our greatest challenge. Students here are encouraged to engage fully in this process.
I'm having these amazing experiences putting in cannulas, putting in catheters. I've been doing suturing on not just pig trotters but live human flesh, and the experience has been extraordinary.
I'd highly recommend coming to the NT Rural Clinical School here in Alice Springs. It's been a fantastic experience. We've got to go out on some great bush trips. The medicine here in town is complex but really interesting and fascinating, and there's a great opportunity to get involved and do things. Working in a cross-cultural environment really forces you to work on your communication skills and think about everything that you're actually saying. We've had great support from the NT Rural Clinical School. The accommodation here is fantastic. We've got access to a 4-wheel drive. We've got phones, laptops, and the staff here are great in helping tailor the program to meet our needs.
Hi, my name's Jacinta. I'm a 4th year Flinders medical student, and I've chosen to do the 4th year stream rurally, which has been 3 months in Nhulunbuy in northeast Arnhem Land, and now I'm in Alice for 3 months.
Hello. Hey, Sunny. My name's Sunny and I'm Jacinta's partner, and we've been up in Nhulunbuy and now we're in Alice Springs, and it's been really good having the clinical school support us all the way through.
Alice Springs Rural Clinical School is a great place to study medicine. Because we're a small town but in a significant remote centre, we offer a real variety of learning opportunities to the students.
Northern Territory Rural Clinical School students gain invaluable experience attending outreach clinics with GPs, bush trips with specialists, emergencies and occasionally retrievals. As well, rural clinical school students work closely with Aboriginal health workers and are considered to be part of the healthcare team.
Hi, I'm Dr. Sara Chalmers. I work for the Lanapoi Homelands Association. I am a 3rd generation rural GP. I've been working for Lanapoi for about 18 months now. I love working in remote communities because you get to be a part of the community. You get to meet lots of interesting people. The rewards are huge. This is the perfect life, the perfect job. There's nowhere else I'd rather be. Come share it with me.
Oh, we like this place. We like doctors, you know, because they're helping us. Doctor Mop, they like to this place, you know, it's a better place, healthy. I seen him last night, yeah, he's good. He told me, you know, he was checking up all my blood pressure and told me everything's clear, you know.
Nhulunbuy is a unique area. It's situated on the northeast tip of Arnhem Land. It's a mining lease, but surrounded by Aboriginal land. It's a vibrant town, it's a young town full of young working families, and it's set up with facilities for young working families. So there's fantastic sporting opportunities here, educational opportunities.
My name's Katherine McNamara and I'm a fourth year medical student at Flinders University. I'm at the moment doing a rural selective package, which is 2 rotations in Alice Springs and 2 in Gove. I've just completed my 12 weeks in Alice Springs. I did paediatrics for 6 weeks and general surgery for 6 weeks.
Northern Territory rural clinical students are recognised for achieving high academic standards and clinical competency in primary care and procedural medicine in rural and remote settings.
I'm Cherie, I'm a Flinders University student. I'm doing my 3rd year in Katherine. I am really enjoying my placement in Katherine. Have also been very well supported during my time here in Katherine. The administration staff have provided us with everything we could possibly need. We have a house, a car. It's a quiet place, and it's given us the opportunity to really focus on our studies here and not spend too much time being distracted. So I definitely recommend doing a placement here in Katherine. It's great.
Katherine's great for medical students. It's a town of about 7,000, but it's big enough to have it's got a fully functioning GP clinic, an Aboriginal medical service and a hospital. I'm in the GP on Tuesdays and it's fantastic. I have my own room, just like a regular GP room would be set up, and there's a little sign on the door that says medical student, and it really is it's fantastic. The hospital's great as well. It's a 60-bed hospital with wards in maternity, peds, general med and surge. And it's also got a radiography department and an ED as well. The Aboriginal medical service is fantastic. It gives you a great experience and exposure to Indigenous health. And when we're at the hospital, we're based firstly on the wards, but when we're not in the wards, we're also based in O'Keefe House, which is on the hospital campus. And the facilities there are fantastic. We again have our own study with quite a comprehensive medical library. And the hospital itself also has a medical library, which is quite big as well. So we each get our own laptop and mobile phone, so we can be kept in contact with the hospital. The facilities in Katherine are great. O'Keefe House is a great place to be based.
Northern Territory Rural Clinical School, an innovative and exciting program providing education, training and mentoring for future Northern Territory medical professionals.